Chronic Obstructive Pulmonary Disease, COPD for short, is a common preventable and treatable lung disease. It remains a third leading cause of death worldwide. Experts say in spite of the ongoing global COVID-19 pandemic, there is never a much more important time to focus on lung health. Good afternoon. The program you're watching is Sound Health on Lagos Television. I am Olasumbo Modupe. Thanks for always staying with us. The program continues after COVID-19 updates.
The World Health Organization has noted that the Omicron variant is likely to spread internationally, posing a very high risk where COVID-19 surges could have severe consequences in some areas. It added that Omicron has an unprecedented number of spike mutations, some of which are concerning for their potential impact on the trajectory of the pandemic. WHO indicated that further research is needed to better understand Omicron's potential to escape protection against immunity induced by vaccines and previous infections, adding that more data was expected in the coming weeks. Over 90 million donated doses of COVID-19 vaccines have been delivered to the continent via COVAX and AVID, and millions more via bilateral arrangements. However, the majority of the donations to date have been ad hoc, provided with little notice or short shelf lives. This, the World Health Organization says, has made it extremely challenging for countries to plan vaccination campaigns and increase absorptive capacity to achieve higher coverage rates across the continent, and for donations to be a sustainable source of supply that can complement supply from AVID and COVAX purchase agreements. This trend must change. WHO explains that countries need predictable and reliable supply, as having to plan at short notice and ensure uptake of doses with short shelf lives exponentially magnifies the logistical burden on health systems that are already stretched. Donations to COVAX, AVID and African countries must be made in a way that allows countries to effectively mobilize domestic resources in support of rollouts and enables a long-term planning to increase coverage rates. Nigerians have been assured that the Omicron variant has not been detected in the country. In a press statement, the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Ifedayo Adetifa, said the center is prioritizing sequencing of recently accrued samples from SARS-CoV-2 positive travelers from all countries, especially those from countries that have reported the Omicron variant. Adetifa urged all states to ensure that sample collection and testing are accessible so that travelers and people with symptoms or who have been exposed to COVID-19 cases get tested promptly. He said, in collaboration with Port Health Services of the Federal Ministry of Health, enhanced surveillance is ongoing at the airports and points of entry, and to ensure compliance with current travel guidance, especially for the Day 2 COVID-19 PCR testing. The NCDC has therefore appealed to business owners, religious leaders, and people in authority to take responsibility by ensuring people in their premises wear masks and adhere to physical distancing. The federal government has directed civil servants from grade levels 12 and below to resume work effective Wednesday, December 1, 2021. The workers have also been directed to get vaccinated before resumption. The directive noted that beginning December 1, all federal government workers are requested to show proof of COVID-19 vaccination or present a negative COVID-19 PCR test result done within 72 hours. It will be recalled the federal civil service workers on grade level 12 and below were directed to continue working from home following a spike in COVID-19 cases across the country.
Joining us via Zoom now is Professor Gregory Erahbor, consultant pulmonologist, Department of Medicine, Obafemi Awolowo University, Ile-Ife, Osun State in Nigeria. Professor Erahbor, thank you so much for joining us this afternoon.
Thank you so much for having me.
All right, Professor Erahbor, let's start the conversation with knowing what chronic obstructive pulmonary disease is all about.
Now, from the name chronic obstructive airway disease, it simply means that it's a disease that has a long span, not just a sudden disease. Now, obstructive means that it leads to the narrowing of the airways, and pulmonary means that it's of the lung. Now, chronic obstructive airway disease can best be described as a poorly reversible, and some people can say irreversible lung disease that continue to progress and its persistence, contrasting it from asthma, which is a reversible airway disease and is episodic. So chronic obstructive airway disease is a chronic lung disease affecting those from 40 years and above who have been exposed to the risk factors and is ongoing persistent obstruction, and is also progressive, affecting the lower aspect of the lungs.
All right, is this condition related to asthma and other breathing conditions?
Now, in a sense, it's related to asthma, but they are two distinct entities, because we have COPD, which is associated with asthma, which we call the asthma COPD overlap. But the two diseases are different. While asthma is basically a relationship between the genetic and the environment, what we call the nature and nurture, COPD is basically an environmental disease. It's a disease we acquire from the environment.
All right, aside from being acquired as a result of environmental factors now, what are the other causes of COPD? Could it be hereditary as well?
Well, there is a particular subset of COPD patients which are hereditary, what we call due to alpha-1 antitrypsin deficiency. That is because you don't have those things that help to stop the proteolytic activities of the lungs. But that subset is so narrow, and in a country like Nigeria, we have hardly seen that. It's not common. So basically, the big load of COPD are those that are caused by environmental and toxic factors without.
All right, I know you explained earlier what COPD is now. What happens when you have this condition? How do you describe it in simple terms so members of the public can know that, okay, fine, it's not just about difficulty in breathing now. Can you describe the condition?
Well, there are three cardinal symptoms. One is cough,
Okay.
and there are the chronic cough, that is a long-standing cough, productive of sputum, and it varies from time to time. Then they are breathless. They tend to be breathless, and this breathless and cough seems to be progressive. They may have other symptoms like chest tightness, and then they may have fatigue and some other systemic disease, other things that can affect the system of the body as a result of COPD. So the basic important symptoms they have is cough, it is breathlessness, it is fatigue, and then sometimes chest tightness or chest pain. Well, chest pain is not very common. And when you see these symptoms in someone who is a smoker but has been exposed to indoor pollution and is above 40, 50 years old and is progressive, you are likely going to think that the patient has COPD.
Professor Erahbor, now, how common is this condition during the COVID-19 pandemic? Because some of the features or some of the symptoms of COVID-19 is also difficulty in breathing. How common? How do you ensure that you don't mistaken COPD with COVID-19 symptoms? And how do you ensure that you report early enough to the nearest health center?
COPD has COVID has worsened the outcome of COPD patients. So if you have COPD and you have COVID, your outcome is likely going to be poorer. Your symptoms are going to be more severe, and you can get into what we call more exacerbation. But the two diseases are different. One is infectious, and the other one is COPD and COVID that COVID worsens the outcome of COPD, makes it more difficult and more exacerbation. But the two diseases are different.
So let us know how to reduce the risk of severity, especially during the pandemic now. How do you, if you're living with that condition, I don't know if you can live with that condition, how do you reduce the risk of the severity of COPD?
The first thing I tell you that COPD is a disease that is preventable and treatable. And first of all, must deal with what causes COPD. The number one cause of COPD is smoking. Now, over 1.3 billion people smoke in the world. And it's assumed by the year 2025, 1.6 billion people will be smoking. Stop smoking. The other one is environmental pollution. And for us in the developing world, the indoor pollution. People who cook indoor with biomass and inhale it for so long, all those things predisposed to COPD. So stop smoking. Stop getting exposed to indoor pollution. The second thing is get a good diagnosis. Doctors will look at your symptoms, they look at the fact that you're exposed and do what we call a spirometry. The third thing is that they will treat you with particular drugs, usually called the long-acting bronchodilators, and they will treat for infection and they will vaccinate you in case for pneumococcal vaccines, pneumococcal vaccine and influenza vaccine. And also, they will also give you oxygen. Some of them will need to take oxygen for a very long time. And then we go to your clinic always, you do what they call pulmonary rehabilitation, the way to help you to breathe better, to live a more satisfying life. And some of them also may need some surgical treatment. But the most important thing is stop the triggers that worsen the situation of COPD.
Are there tips to embrace to keep our lungs healthy now, Professor Erahbor? Now, if you can share some tips with us, those that are not living with that condition, are there tips to keep our lungs healthy?
It's sustained by our breathing system. Now, somebody was just telling me there's a part of the country where there's so much gas flaring. There are some part of the country like Lagos, we could use fumes, a lot of diesel fumes, generator fumes, and the place is so polluted. Restrict pollution, restrict exposure to environmental pollutants, either industrial pollutions, occupational pollutions, environmental pollution. Stop smoking. Now you can be primary smoker or passive smoker. The passive smoker can infect those who with COPD. So let's stop smoking, whether it's passive, whether it's first degree, second degree, or third degree. So stop smoking, get clean environment. Second thing is don't hang around smokers. The third thing is that we must have a national and international legislation against smoking. We must keep our environment clean from all form of industrial, occupational, and pollution, because those are the things that will destroy the lungs. We should stop using all kinds of cooking materials indoors that can further increase the biomass and affect our lung. If you are an asthmatic, you must be connected with a doctor, possibly a chest physician, who will type your asthma, that is the degree of your asthma, and give you measures where you can take a self-management plan and prevent frequent episodes of asthma, which will eventually progress and then lead to further what I call damage of your airway architecture and lead to permanent damage. So the most important thing is let's work both legislatively, let's work locally to get a clean environment. Our lung want to inhale good, clean environment. Everything that goes into your lungs by your breathing affects your lung and may start up processes that can lead to chronic lung disease. Now, if you're having symptoms, go for screening, go for examination. Let the doctors look at you and make the right diagnosis and follow the required prescription and the required lifestyle modification. Then vaccine is very important. I've always been advocating for 60 years old. And flu vaccine for adults who are above 60 years old. Now, we are getting older population in Nigeria because good lifestyle, things are better than in the past. And so for those who are older, 60 and 65, they need to be vaccinated for pneumococcal vaccine and H influenza vaccine, especially if they have a lung condition. Then COVID can worsen any situation in the lungs. And so we must get vaccinated for COVID and use all the necessary precautions so as not to get COVID. And when we have it, we go for take the necessary isolation and then the measures that are prescribed.
So before I let you go now, Professor Erahbor, does tuberculosis fall in this category now?
Now, tuberculosis is clearly well defined because it's caused by bacteria. And the big issue about tuberculosis is that if somebody has tuberculosis, the person can infect others. And there are things that make it more difficult easier for people to get tuberculosis. The environment. If you have if you stay with people in a house that is overcrowded, if you have toxic factors like alcohol or smoking, if your immune system is depleted or deranged, like you have HIV, you are taking immune suppressive drugs, you have immune suppressive disease, and then if for some reason you belong to the at-risk extreme of age, either your immune system is not yet developed or your immune system is waning off. Those are what causes that will give you more disposed to tuberculosis. If you have diabetes, for example, you are more likely prone to have TB. But the good thing about TB is that nations are going around the world to treat TB. Treatment of TB is free, and that treatment is easily diagnosable in our district hospitals. And then if you have that disease, you are treated, you not infect others, and then reduce the community expansion of this disease. Stick to your drugs, and usually it's a DOT system, directly observed treatment. You stick to your drugs, follow the procedures, and then you not give a long-term damage to your lung. It's not just being healed of tuberculosis, making sure the sequelae that are on your lung is not damaging.
Professor Gregory Erahbor, consultant pulmonologist, Department of Medicine, Obafemi Awolowo University, Ile-Ife, Osun State. Thank you so much for sharing your expertise on chronic obstructive pulmonary disease.
Thank you so much for having me.
Up next is Trending Health Reports. Please stay tuned. that's it on Sound Health this week. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. Stay safe always. Remember, a sound health is a sound mind. Make healthy living your choice.